Hello,
There you
everyone.
go.
Welcome. Sorry, we're having a few technical issues, so just let us know in the comments if you can see us, if you can hear us. We will just wait a few minutes to get started as people start to trickle in. But welcome. We are here today to chat about sundowning, what it is, what the symptoms are, and what you can do to handle that if you have a loved one experiencing that. So, welcome, everyone. We'll get started here in just a few minutes. Hi, everyone. I see a few people trickling in. Yay. Okay, James says he can see and hear us. That is perfect. That's what we want to hear. Thank you for the feedback, James. Welcome, everyone. I am joined by Dr. Marianne Matzo. My name is Taylor Schumann. We're going to be chatting about sundowning today, so we will get started in just a few minutes and just let people make their way into the room. All right, it looks like we have some more people coming in, so we will go ahead and get started. Welcome, everyone. My name is Taylor Schumann. I am the editor and senior tech expert at SeniorLiving.Org, and I'm joined by Dr. Marianne Matzo for our live Q&A on sundowning in older adults. We're super excited to jump into this. Thanks for joining. But before we get started, I would love to give you a little bit of background on Dr. Marianne. If you're new, but if you're not new, you know all about her awesome background. She is an expert in palliative care and a certified gerontological nurse practitioner with a career dedicated to caring for older adults, improving end-of-life care, and education. She's a retired tenured professor of nursing with extensive experience as a hospice and palliative care nurse, researcher, and educator. Since retiring, she has founded Everyone Dies, which is a nonprofit organization dedicated to educating the public regarding serious illness, dying, and bereavement through weekly podcasts and a children's book. So welcome, Marianne.
Thanks. Good to see you.
Yeah, thanks so much for being here. So we are going to be talking about sundowning today, what it is, how to deal with it, all of the things. So before we jump into Q&A, which feel free to drop your questions in the chat at any time, Dr. Marianne, do you want to tell us just a little bit about what sundowning is?
Sure. People think that sundowning only goes with dementia or Alzheimer's disease. And that's really not true. So if we're going to talk about just a definition of sundowning, the typical early signs in delirium can include sundowning, withdrawal from the environment, irritability, new forgetfulness, befuddlement, and our new onset of incontinence. Later signs can be outbursts of anger, hostility, abusive behavior. Confusion, agitation, or restlessness is usually worse at night when a person can become disoriented to who they are, where they are, the date, and the time. And so that late afternoon, evening kind of confusion is what is referred to as sundowning. And so we have this great slide from the Alzheimer's Association that shows the symptoms that typically that you would see. But sort of what's happened is over time, as we've done more research, is that we've been able to document that sundowning doesn't only occur for people with dementia. It can happen in any older adult without any disease. It can happen in young people, and it can happen in older dogs. And we had a quite old dog who I would watch at night in the late afternoon, and I would say, God, I swear she's sundowning. And then I did a little bit of research to see, I didn't know dogs could sundown. And sure enough, animals can do it too.
That is so interesting. I never knew that.
Well, that's why I'm here, Taylor, is to bring the tidbit.
You are the expert.
Yeah.
Awesome. Well, that really sums it up well. Was there anything else you wanted to add before we move into just general Q&A?
I think that that's a good kind of definition. And then I see James has a question, and I'll go into more details.
Okay, awesome. All right. So James asks, does sundowning ever involve a radical change schedule, such as sleeping in till mid-afternoon or staying up late into the night, for example?
So, James, that more goes with the disease of Alzheimer's itself. What happens in Alzheimer's is that there's confusion of the sleep-wake cycle. So you will see that people living with Alzheimer's disease will stay up all night and want to sleep all day. And there are the really good kind of Alzheimer's units or facilities. If you're looking for one for a loved one, you want to look to see, do they have people scheduled at night? Like I can remember one unit in my area when I lived in New Hampshire, that if people were up at night, they had a tech who did activities in the evening, and they would bake cookies in the middle of the night because people were up and they wanted to, do things, or they needed to be kind of kept a little busy. But if that person's living in your home, it's really, really stressful, because if you have to go to work in the morning and you're up all night with a loved one, it's really hard to be able to kind of live in, the 9-to-5 world when you've been up all night, and that happens every single night. So I think, James, what you're referring to more is that confusion of the sleep-wake cycle. And the sundowning comes literally in that late afternoon when the sun is going down. And I'll talk a little bit more about why that is and how that goes on. But I would say, to your question, I'd say no.
That's great to know.
How's
and
that for a
you.
short, fast answer?
I love it. Thank you for that question too, James. And if anybody else has a question, you can drop them in the chat at any time. You'll just need to be signed into your YouTube account. But anything related to sundowning, or if there's other topics that come to mind, Dr. Marianne is the expert, and she's here to answer anything that you have. And you brought up kind of that it happens, at night or as the sun goes down. Do you want to dive into why that is, or is there research around why that might be?
Yeah. So there have been some recent studies that have looked at, really kind of defining sundowning syndrome. And so this is and the reason researchers come up with the definition is because you want to kind of agree on a definition, so that all the people who are studying a phenomenon, whatever it is, you're looking at it through the same lens. So the definition is a cyclic delirium-like condition of older persons that lasts a few hours and occurs around the sunset hour, where no direct physical problem or other medical condition exists. So the behaviors that you see with sundowning are the confusion, anxiety, agitation, aggressiveness, with an increase in motor activities. And what I mean by motor activities is there's more pacing, wandering, yelling, and all of it kind of gets worse. Whatever time your sun starts to go down, it gets worse until the sun has gone down. So the current thinking about this is that the behaviors occur at sunset because it's an impairment of our circadian rhythm, from damage to sleep. Our sleep center is in the hypothalamus, and the thinking is that there's some sort of damage within that area as a result of the plaques and tangles that happen with Alzheimer's disease, and also a decreased production of melatonin. Now, melatonin is, you probably heard about it. You can buy it at CVS or Walgreens, wherever you shop. But it's a pill, and it's a hormone, really, that regulates the circadian rhythm. So people will use that if they have trouble falling asleep, although it's not meant for long-term use. And in particular, we'll use it for people who do a lot of traveling, who are crossing time zones and have trouble falling asleep because they're on Paris time and not on New Hampshire time or whatever. And so you can use melatonin to help your brain kind of reset to where you are. So the thinking with sundowning syndrome is that it's, like James is saying, okay, they're sleeping all day, they're up at night, everything's all up in the air in terms of, when they go to sleep and when they wake up. Well, that can contribute to the fact that they're not sleeping well and that their hormones are out of whack. And so therefore they're having the sundowning syndrome. So the circadian dysregulation can occur when there's not enough exposure to light during the day. So if the person's inside all the time, if there's low lighting, if they're in a place where there's not a lot of windows, and increased shadows can heighten that late day confusion. because part of it is looking at something and misinterpreting what the reality is. So they see a shadow in the corner, and like sometimes something might move or whatever, and you could look and say, oh, the sun's changing where it's coming in, so the shadows are different, because your brain says, okay, I can look at that and I can see that's what's happening. But with somebody with a dementing illness, they can look at the same thing you're looking at, and instead of saying, oh, here's this logical conclusion as to what I'm looking at, they instead see, another person who's maybe coming for them, or some piece of danger. And so they get upset, they start hollering, they start throwing things to get, that evil thing away from them. That's not there at all. So then you, as the caregiver or the staff in the nursing home or wherever that person is, are saying, oh my God, look how agitated he's becoming, and not really even thinking about, like, well, are the shadows different? What is it that's aggravating them?
That's so interesting. So you mentioned, the lighting can play a role. Do other things like maybe medications or pain or things that disrupt sleep impact these episodes?
Well, so if you think about, there's yes. So the simple answer is yes. And then if you think about, so it's happening late in the afternoon. So what goes on late in the afternoon? Well, when's the last time they ate? So it could be their blood sugar is low. It could be that they're hungry. And instead of being able to say, you know what, I'm hungry, instead comes out as a behavior. It could be that if they're in a facility of some sort, we used to, back in the old days, call it like the change of shift syndrome, because we would think it was because, well, it was back when we had 8-hour shifts, everything, back in the old days, it was all different. Nurses used to work 8 hours. You work 7 to 3:30 and 3 to 11:30. So when does this happen? It happens right when that we saw it as it's a change of shift. Why is a change of shift making people get really agitated? Well, it wasn't the change of shift as time went on. We realized that's not what it was. It was the sun going down. But also in that period of time when it's changing, you've got less activity, you've got more noise, you've got less sort of structure, you've got twice as many people in that facility as there were an hour ago, because you've got 2 shifts together. The day shift's trying to get the heck out. The night shift is maybe running late. So it can be a little bit, high tension at times. People will react to that. So if let's say they take their medicine once a day, so they take it in the morning. Well, the time 4 o'clock runs around, their blood levels are lower. So there's an issue. There's a change in their drug level. Pain medication may be wearing off. So if people are in pain, even people without any dementing type illness, if people are in pain, they're irritable. Just think about it. When you're probably not your nicest person when you're feeling pain. And so here you are in an environment, your pain medicine's wearing off. There's all this confusion, the sun's going down, and there's this perfect storm to result in behaviors that are, hard to deal with. So all of these factors can increase agitation for the person.
That makes sense. A lot of pieces to the puzzle, it sounds like. And one of our viewers, MD, asks, can sundowning only occur to those who have dementia?
So no, sundowning can occur with people. In the beginning, I said it can occur with animals. It occur with older people who have no illness whatsoever, including dementia. Even young people can have sundowning. So no, to answer your question, it's not just with dementia, but you'll see it more with people with dementia. And then the behaviors, like if I sundown, hopefully, if I sundown, I have enough cognitive ability not to get overly agitated, not to try to break through the door to get away. I have some cognitive ability to say, my pain medicine must be wearing off. God, when's the last time I ate? I can start to think about, I'm feeling this way. What can I do to fix it? Well, what we have to do when we're caring for people who are living with dementia is that we have to think that through for them. It's like, when's the last time you had a pain pill? When's the last time you had something to eat? I was always well known in the nursing home. I always had graham crackers in my pocket. And my first intervention was, here, have some graham crackers and a glass of milk, if they weren't diabetic, and there was no problem with them doing that. And, I'll tell you, graham crackers and milk can soothe just about anybody.
I love that.
And we don't stop to think about such a simple thing as helping people to settle down.
Yeah, I love that.
So in MD, if I didn't answer your question enough, please just put another one in and I'll see what I could do with that one.
Okay, so you talked about graham crackers a little bit. What other things can caregivers be doing to help calm a loved one experiencing sundown? And also, this is kind of a two-part question. What environmental adjustments like lighting, noise reduction, all of those things can they do to help reduce symptoms?
So we can look at the things that are taking a toll on an old person's body that can make sundown symptoms worse. These are things like not getting enough sleep, being in pain, being depressed, stressed, constipated. We don't think, well, can that be a issue? Well, yeah. And if you're feeling kind of things aren't moving, you can get pretty cranky too. Urinary tract infections, too much activity or too many people around, dehydration. I mean, we could do a whole talk about dehydration because if you're not, Taylor, I saw your mug that you drink out of. Show everybody your mug.
My big old Stanley.
See? Taylor is never going to get dehydrated. But she can carry that around. She can fill it up. She can say, I'm a little thirsty. I'm going to drink. Older people may not have the access to the water, to the big jug. We might not stop to think, how long's it been since they've had something to drink? And I'm telling you, especially in older people, dehydration is a really big problem because they're dependent on us. Many of them who have a health problem, physical or mental, they're dependent on us to come by and say, here, have something to drink. And if you're busy, if you're at home, taking care of somebody, or if they're in a facility taking care of somebody, you can get really busy and not stop to think about, when's the last time my group of patients have had anything to drink? That's what I'm talking about. The milk and the graham crackers, it's like it takes kind of care of the hydration piece and the blood sugar piece of it. And also things like lighting in the room. Like we think, we can see perfectly well. But if you have an older person who maybe has cataracts, so the cataracts, the lens gets cloudy, gets yellow cloudy, and you have trouble having enough light to see. So if you have cataracts, the lighting is low for the young people who don't need a whole lot of light around. And they're like, I'm seeing shadows. I can't see where I'm going. I can't find what I'm looking for. And then that gets misinterpreted as somebody took my glasses. Or I had a patient once who was in the home who was somebody was always taking her coffee. And her family was always buying her coffee. And there would be bags stashed and hidden all throughout her house because people were stealing her coffee. And what it was she was hiding it so the person wouldn't steal it. But when she hid it, she forgot she hid it and she forgot what she did with it. And so it's sort of this perfect storm of these things happen, and then it's very easy to misinterpret. So then you ask about possible treatment. And really what you want to do is you want to prevent sundowning. Best thing to do, prevent it. And how you do that, one way, is to correct the circadian rhythm. So you can do that with melatonin. Now, I'm not suggesting anybody go to wherever you buy melatonin and start giving it to people. what you want to do is you want to talk with your whoever's managing the dementia or the family practitioner and say, George is having these symptoms. And I heard a lecture that said maybe some melatonin would help. How does that fit in with all the other drugs that he's taking and all the other issues that he has? And can I start him on some melatonin, and what would be a good dose for him? Now, it's entirely possible that when you go to talk to a healthcare practitioner that they might say, I never heard about melatonin for sundowning. But if they look it up, they'll say, oh, yeah, there's some new research out that might help. So you can bring the information that you've learned to your healthcare practitioner. But I wouldn't suggest that you just, go to CVS and buy a big bottle and start giving it to them, because you don't know all the other stuff they're on and how that's going to interact. So find out if they can take melatonin, how much would be good for them. The other, there's an antipsychotic called Risperidol that has been shown that can be helpful for people who are sundowning. And there's Aricept that's given to help prevent the progression of Alzheimer's disease that can also help with sundowning. So those are 3 pills, if you're looking for a pill, that can have shown in studies to be helpful with people. And then you've got the whole environment. The environmental treatments, really important, are light during the day. So if you have a circadian rhythm problem, we need the light during the day. And I've even heard lectures that for those of us who don't have sundowning or a dementing illness, what has been said is that when we get up in the morning, do whatever you're doing, get dressed, and then go outside and look where the sun is. So it's still going to probably, assuming the sun is out when you're up in the morning. I'm in Oklahoma, and when I worked 6:30 to 4:30. So I'd go to work in the dark and come home in the dark.
Oh,
so, but if you're doing that, find a time, take your break or something, or just say, I got to go look at the sun when the sun is out, and go out for just 5 minutes and look at the sun. And at that time, it's pretty low in the sky. It's not going to hurt you unless you have a problem that's going to hurt you. And if, talk to your physician if you think that that's the case. But just look at the sun. And what that does is that there's hormones in your body that respond to the sunshine. And if you think about it, how often do you kind of get just like 5 minutes of sunshine on a daily basis? Now, for those without any, Alzheimer's or anything, what that can do for you is it can kind of reset your hormones. And in about 3 days, you're going to feel a lot better. You're going to have more energy. You're going to have sort of more positive mood kind of thing, because your hormones are kind of getting reset. I always say this to people. I'll say it to all of you listening. We're animals. We came through and developed, and we're used to getting up with the sun. Our bodies are programmed evolutionary wise to get up with the sun and go to bed with the dark. And the whole idea of artificial lights and anything like that is, in the scheme of how long humans have been around, a really modern thing. And so to just kind of live your life by, you could live inside your house. You could never go outside, but you're not getting sort of the natural things that the body is used to receiving. So without a dementing illness, early when the sun's up, give your eyes just like 5 minutes of sunshine, and see if not in a couple of days you start to feel better, and make that a daily habit. So for people with a dementing illness, what you want to do, the ideal time to take them outside is between 9:30 and 11:30. You can also use light boxes if there's some reason that you can't take them outside. So the light box is just literally a box with a light bulb in it that has the wavelength speed of the sun. And when I was working 6:30 to 4:30, I had one on my desk. And I would, whatever it was, 15 minutes, whatever the instructions said, I would turn that on while I was at my desk, calling back patients or whatever I was doing. So I would at least get that 15 minutes of sunlight. So that's, if you can take them out, take them outside. That would be the best thing. Or if not, get a light box and get that on Amazon. I hate promoting Amazon, but they have everything.
They do.
And just turn it on between, sometime between 9:30 and 11:30. And before I go on, is there some questions here that need to be answered?
Yeah, so it looks like you just answered. One of our viewers, Ryan, asked if you have any tips to lessen the symptoms of sundowning. So you just went through a lot of those. Do you have any other things you want to add to that?
Oh, yes.
Perfect.
I have a whole list.
Love that.
So the other thing you can do is you can plan pain medications to be given like in mid-afternoon, so that they're still in effect. They're still working when the sun is going down. So depending on what you're giving, you can look it up online. But, like if somebody's on Tylenol, for example, that will last about 4 to 6 hours. So time it so that in that period when the sun is going down, and of course you'll have to change it for the different seasons, time it so that 4 to 6 hours where it's still working will occur when the sun is going down. So if pain is the issue, pain is what's contributing to it, that's an easy way to fix it so that they have some pain management on board and maybe won't be so agitated. Activity is a great treatment. So as the sun is setting, you can give people activities, let them help you make dinner. Things that will distract them from the fact that the sun is setting, from the feelings that they may be feeling. Give them a reasonable task that they can do. In the nursing homes, we would always keep baskets of, it could be rags, it could be actual clothes that needed folding, and give them to people and say, hey, would you fold this for me? Or sort socks. You have a whole basket of socks of different colors. And people can do that, and it keeps them busy, and they feel like, and you say, oh, it would be so much help to me if you could sort these socks and put them together for me. It would save me so much time while I'm making dinner. Why don't you sit with me? I'm going to make dinner and you sort the socks. Well, then they've got, and turn the light on. So there's good light. They have something to do. Their pain is managed. You're making dinner. It smells good. You can say, do you want a little bite? Hey, how about a glass of water or some tea while I'm doing this? You can hit a lot of the reasons that people could be sundowning in a simple thing like that. Also, things like playing music, doing a sing-along, which you could do while you're making dinner and they're sorting socks. You could sing songs together. And like I said, leave the lights on so that there's no shadows to be misinterpreted. Another thing that we have that back in the old days, but something we have now is that we have Skype, and we have TikTok, and we have, like we could put our laptop down or a iPad down or whatever, your phone, and you could say, hey, your great-grandchild just got home from school and she wants to talk to you. So let them sit and talk to whoever. They might not even know that great-grandchild, but here's this nice little kid who's smiling and calling grandpa, and, let them sing songs with them. My father-in-law, when he had dementia, and this guy never liked dogs, but in his end years and with his dementing symptoms, he loved dog videos. So you could just pull up dog videos on TikTok, and he could sit there for hours swiping through and laughing at the antics of the dogs or the cats or whatever it is that they like. So there's this, and sometimes people don't stop to think about, give them the iPad and let them scroll. I mean, think about how you can just get lost in the zone with some of those things. Let them get lost in the zone. Then I also mentioned about dogs. So do you want to talk about dogs?
Why not? Let's do it.
All right. So dogs can have sundowning behaviors, and it looks the same way as it looks in people. And it could be part of canine cognition dysfunction. And symptoms can occur in about 68% of dogs by the age of 16. That's our 16 years, not whatever it is for dogs. Or you could put it another way, about 2/3 of 15 to 16-year-old dogs have some level of dementia.
Wow.
And when Dimple, our dog, died, she was 15 and a half or 16. And it was just in those later months of her life that I thought, this looks like Sundowning to me. So some signs of dementia in dogs are disorientation, changes in social behavior, changes in sleep patterns, potty accidents, like our Dimple would explode in the old days before she would, have an accident on the floor. But as in those probably like last 6 months of her life, it would just. And so I said, well, the rest of her was sort of okay. I mean, we knew that she was coming towards the end of her life. So we got doggy diapers, and we thought, this was a Australian Shepherd who was, had queen-like tendency. And I thought, she's never going to put up with having diapers on. But she would stand there, we'd kind of like put her head, like this way. And so we have her bum this way, and we put the diaper on her and give her a pat on the back, and off she'd go. It was like, she didn't mind it at all. I thought that was very interesting. But you could see increased anxieties, changes in activity or appetite. Like in her evening meals, she wouldn't eat, and I'll admit, hold the kibble in my hand and give it to her piece by piece, and she'd eat it that way, but she wouldn't eat it any other way. So when you're thinking about sundowning, really think about it as a change in circadian rhythm. And you focus your interventions on how do you maybe not make that happen at all by letting them have some sunlight during the day, during that, like I said, 9:30 to 11:30, and then distract for the other stuff. And if people have specific questions about this or anything else related to their caregiving, I'm happy to chat with them, answer your questions.
Well, Simone says, wow, I had no idea about this. Now a lot of things are making sense to me when I think about my family's dog. And I'm thinking about my grandma's dog that passed a few years ago. And it seems like a lot of the symptoms, that's something we never even think of in dogs, I would say.
Yeah.
Crazy. MD asks another great question. She says, is sundowning an eventual effect for most people with dementia as it progresses? Or is it, where is the link really strong between dementia and sundowning?
Yes, it is. It's very strong. Does that mean that everybody will get it? No, it doesn't mean that everybody will get it, because if somebody has dementia, but they don't have any pain issues and they eat regularly and they're always given water and, sort of all of the things that can cause it aren't there for that person, it's not going to come out of the blue. So it comes from not having their eyes in the sun and these other things that then make the misperception and the changes of the time and the sky getting dark. All those other things can aggravate that.
That makes sense. So we've talked a lot about, how to help the person experiencing sundowning. And I would also love to talk about, families and caregivers and how it impacts them as well. So I know it can probably be emotionally draining, frustrating, confusing for families when they don't really know what's going on. So what coping techniques or resources or just general advice would you give to those caring for a loved one experiencing sundowning?
Well, my go-to thing is always educate yourself, which if you're listening to this, then you're doing that. This is one of a whole lot of symptoms, a lot of issues that people living with dementia will can exhibit. And so and it's something that can go away. All this, like one night you're like, what's going on? And it might happen for a few nights, or you might say, oh, wait a minute, let me get my list out. I got to make sure I turn my lights on and do this and do this. And then you can maybe, that's the end of it. You're managing it. Or as time goes on, because with Alzheimer's disease or any of the dementias, it's always a moving target. You feel like as soon as you got like one piece figured out, there's this next thing. And it's like, could we just enjoy this for a little while before something else happened? But that's the nature of this. And so you have to be, as a caregiver, very flexible about saying, oh, good, yay me. We're not dealing with this agitation at nighttime now. But now all of a sudden they're wetting themselves. Or now all of a sudden they're trying to escape, or all the, there's a lot of things like that can come with Alzheimer's disease. And so enjoy the win with the sundowning. Know that this is a progressive disease and that there will be other things coming your way that you also have to learn about and figure out, how am I going to address this issue? So did I answer that question?
Just how family caregivers, like what coping techniques or resources maybe you'd recommend?
So flexibility is really important. So I think that's what I was getting to with all of that. It's like, don't get too attached to the fact that you figured this one out, because there's going to be lots of other things that you're going to need to figure out. And we've talked, in the past is having support and help. And a lot of people really don't want that. Like they think, oh my God, I need somebody to help me with this. And then by the same token, but I don't really want other people in my house. And I don't really want to tell anybody else, what my husband's doing and how my husband's behaving. And so that lends that caregiver to isolation. Again, with the internet and being able to be in a Facebook group or to be in a senior living group or all of those resources, there's so much that you can access without leaving the home. And there's support groups that are virtual. You don't have to leave the home, where, 10 years ago, if you were going to get support, you had to figure out, what are you going to do with, the person you're caring for, and then leave them and go wherever, which makes it's just like, that's just too much work for whatever it is I'm going to get out of it. I'm not going to do it, is what people would say. But now, if you can sit down and, maybe they're napping, whatever, you can talk with other people, get other ideas, go, the references that we give you, take advantage of those, listen to those. You can put an iPod in and clean the house. I mean, you put one in and you can still hear what's going on with your loved one and get some ideas. So there are a lot of resources. You're totally not alone, especially if you have a computer or an iPhone or anything that can help you connect with that outside world. But the best thing that you can do is listen to those and take some notes and say, oh, I could do this one, and I can do this one, and I could do this, and let me experiment and see, does that make the situation better? Oh, well, those 3 didn't work, but let me add this one in and take this one away. You can treat it like a game, even though it's not a game. You can treat it like one. Let me see what I can figure out that will make this situation better, that will make him or her, whoever you're taking care of, less agitated, less upset, living kind of the best life that they're able to with this disease. Now, if you're caregiving in the house, the research indicates that there's really just 2 things that make people say, I can't do this anymore. I need to look at, care facility, a unit or something like that. Does any of the listeners want to guess what the two things are that people say, I can't keep them at home anymore?
Well, that's a good question. Yeah, listeners, do you want to drop in there? Do you want to repeat what it was that we should have them guess?
What would you say would be the two things that would make a caregiver say, I can't keep this person with dementia, with a dementia diagnosis at home anymore?
It's a great question.
We don't have any prizes.
I know, we should have a prize. Well, while we're waiting for people to come in and answer that, I would love to share those resources that you provided me. They're really, really awesome. So first off, we have Dr. Marianne's podcast, the Everyone Dies podcast, has an episode all about sundowning. So you can scan this QR code. I will also drop the link to the episode in the chat. So that's a really great resource. Is there anything else you wanted to speak to about that episode?
Nope. I mean, the thing is with this topic, we have a lot of podcasts about all different aspects of dementia. So this is just one. So, go look around. There's lots of education there for you, and there's no cost. Go help yourself.
Yeah, absolutely. Everyone Dies is a great resource. So I would highly recommend it, not just on this topic, but anything related to growing old, to dying, just all of those topics. There's so many resources. And it looks like we have a few people who responded to the question. So what are the two things that you would think would make caregivers say, I can't do this anymore, and they need to take their loved one somewhere else? Simone says the caregiver can't keep them safe anymore, and MD says they become violent.
So, Simone, you're close. I'll just tell you the two things. One is wandering, and the other is incontinence, people who can't control their bowel and bladder anymore. And so the wandering piece of it is that, no matter, I've heard family caregivers say, no matter what I do, they're like Houdini. They get out the door and I don't know how they do it. And then they wander and they go wherever. And, and you hear these silver alerts, about somebody got out, especially, and it's especially bad in places where there's winter, and it is winter, if they get out, they're in their slippers, or if they're lucky, they're in their slippers or they're in their bare feet. And it could be that they truly, that's why you're saying, Simone, that, safe. They're not safe. They could freeze to death very, very quickly because they get out, they get confused. I used to run a family support group for people who were caring for somebody with Alzheimer's disease, somebody in their family with Alzheimer's disease. And I did that for many years. And the stories that I would hear would just like make your toes curl. It's like, oh my God, what do you do? And I had one person talk about how their loved one got out of the house. They weren't sure how, somehow got on a bus and rode the bus as far as the bus went, got off the bus, no idea where they were. Just no idea, phone numbers, anything. And the caregiver at home is frantic. And, and what do you do? And this was, I'll admit, was earlier in my career. So there, we hadn't come up with, well, what about ID bracelets? Or, now you can put a tracker on them and you can see where they are. There's a lot more technology that we have now so people can't get lost like that. But think about, 15 years ago, we didn't have that, and they could be anywhere. And so that's that safe piece of it. And then the incontinence, and you think, well, there's adult diapers, but people take them off. They leave them laying around. They take them off to have their bowel movement on the sofa. I mean, it's these things that the caregiver says, I can't do this anymore. So those are the two kind of straws that break the camel's back, if you will.
Yeah, that totally makes sense. And those must be really hard things to deal with, especially if you don't come from a medical background.
Listen,
So,
even if you do come from a medical background, it's
yeah,
very difficult.
absolutely. Well, as we start to wrap things up, is there anything else that you want to talk about related to sundowning, Dr. Marianne?
Gosh, I think I gave you the latest research, which I think it's important to say, well, what do we learned about it? So that the circadian rhythm and the melatonin, those are two kind of newish things as, possible interventions to help. So I think I gave you, I don't want to say everything I know, but probably everything I know.
No, absolutely. This was very comprehensive. And if you're looking for more resources, Dr. Marianne has, as I mentioned, her podcast. And then she also is featured in an article that gives some expert advice on sundowning and to learn more what to do if your loved one is experiencing symptoms. So I'll go ahead and drop that in the chat as well. And then we also have an article on senior living with some expert insights from a doctor who specializes in senior psychology. And she talks about sundowning and the symptoms, and it's just a great reference as well. So those are both in the chat too. And then as Dr. Marianne said, if you are experiencing this with a loved one and you're the caregiver or a family member, you are not alone. And we want you to know that, especially here at Senior Living. So we would love for you to join our Caregivers Corner if you are looking for community or for advice or just to talk to somebody else who gets what you're going through. This is our Facebook group where we have other caregivers and family members who meet, and you can get advice, you can get resources and experiences. We cover topics like things we talked about today, and there's lots of really great kind of bonus content if you join the community from Senior Living. So make sure to join that as well. And thank you so much, Dr. Marianne, for being with us. This was such a great chat.
Thank you for having me. And can we just throw it out to listeners, if there's topics that you want to know more about or just are curious about, whatever, we'd be happy to do a live broadcast about that.
Yeah, absolutely. So feel free to leave if you want to leave in the chat or just in the comment section of this YouTube video. Please feel free to leave any topics that you're interested in. Or if you join the Caregivers Corner, you can also drop a message there as well. So we're always looking for things that you guys are interested in. So don't hesitate to reach out if you have questions or just have topics you want to cover, because we would be happy to.
Great.
All right. Thank you all so much for joining, and we'll see you next time.